was a doozy yesterday.
I think they may have even had a tornado out on the Cape today, too.
Good evening, ladies and gentlemen, and welcome to another edition of Know the Facts. Like I said last time, I have the great pleasure of having Dr. Claremont on the show tonight. Tonight's going to be a little different. We're going to make it a full hour. At the end of the first half hour, we're going to have a little intermission, and then we're going to start again. So, all I can say is get your pencils and papers out. It's going to be very, very, very interesting. And if you don't watch it, you're missing everything. So let's start with show is yours, sir.
Okay. Thank you for having me on again.
No problem.
Yeah, we're gonna talk a little bit about aging. Normal and abnormal things that happen when we all age. And I know because I'm going through it too. So that's why I can speak from experience in most of these things. Remember when I first started a few weeks ago when we did our first show, I told you a little bit about that cartoon character Pogo. He said, "We have met the enemy, and it is us." Well, if you read the papers in the last few days, and God, I hope you do, you notice that one of the councils on aging actually changed the name of the senior center. They no longer wanted it to be senior center. Now they're calling it the social center. Now talk about caving in. Caving in, totally. See, we are our own enemies, and they don't even realize it. They thought they were doing a good thing. So at any rate, remember, aging is not a disease. It's a natural process. We all go through it. And all of our organ systems participate in this. And they all deteriorate a little bit at a time. It's progressive, it's slow. But still, it does slow you down in all of the systems. And this is what we're going to talk about. A lot of them you may have already had. And so you'll understand. Some of them you may not understand. When is it normal? When do you call the doctor because it's abnormal? That's what we're going to talk about. Okay, first of all, let's start with the simple things. Let's say your height. We all shrink. Why? Well, you look at the vertebrae, they have this cushion in between each of the bones in the vertebrae. They shrink with time. You can lose 3, 4, 5 inches when you get into your 80s and into your 90s. You'll be about 5 inches shorter than you are now. Natural process, nothing that is abnormal about that. So the height goes down. What about the weight? Well, people don't tend to be as active when they're older, especially if they've retired. And so what happens? They begin to put a little weight on, usually an average of about 10 to 15 pounds. When you get to be about 80 or so, there's a natural loss. Your appetite is less. You lose about 10 pounds of weight over several years. Now that changes your appearance, obviously. You're shorter, maybe a little thinner now. That is normal, absolutely normal changes. Nothing to worry about. What about your blood pressure? Blood pressure gradually goes up. You know that over 60, over 50% of the people over 60 have hypertension, high blood pressure, over 50%. And most of them are on medication, if they take it. And so that's a natural thing. Your arteries get a little harder as we get older. It's a little tougher for the heart to pump. Blood pressure goes up. What about the heart rate, the pulse rate? Well, first of all, pulse rate tends to go down a little bit because the nerves in the heart that will stimulate the heart to pump, the nerves deteriorate a little too. So the heart rate tends to go down a little bit as we get to our older years, say 75 and older. When do you call the doctor for something like that? 3 indications. Number 1, pulse is too slow. You're starting to pass out or feel dizzy. You got to sit down frequently because the pulse is in the 40s. Now that may be normal in the 20s when you're a real athlete, not normal when you're 80. And so, too slow, too fast. There's a lady up at the senior center now. She kept coming in for her blood pressure check. We checked the pulse, 120, 130, 140, consistently. And I told her, listen, your heart's working like hell. You got to do something about this. And so she did. And so one day I picked up an irregular heartbeat. So too slow, too fast, irregular heartbeat. She had atrial fibrillation. So they're going to do a little procedure to slow that heart down. So those are the 3 times when you need to immediately call the doctor. Too slow, too fast, irregular, not beating on a regular table. Okay, that is the pulse. What about your temperature? Well, normally we're running around 98, 98.6, roughly. What is too cold? Under 95. You've heard of that term, hypothermia. Elder people don't have that regulatory system in their body like they did when they were younger. They may not feel the heat or the cold, so the 2 extremes. They tend to get overheated fast. They tend to get frostbite fast because you don't have the protective mechanism anymore. And so you got to watch the temperature. Under 95, over 102. Those are the extremes. Okay. What about the breathing rate? That depends on what state your lungs are in and what state your chest wall is in. Now, why chest wall? Because the chest wall tends to solidify a little bit as you get over 70, 75. They begin to get all of the little joints in the ribs and all that connect to the chest bone, connect to the back, to the vertebrae. They tend to cement a little bit. They tend to get stiff. And so you may get a little less movement in that chest wall. The extreme would be if you had no movement in the chest wall, and now you're just breathing with your diaphragm, and that's it. And that can happen too. And so the respirations go up. What you do if you're not getting the amount of air in, you tend to breathe faster to try to get more air in. So respiratory rate we watch. Normal would be anywhere from 12 to 16 per minute. You go up into the 30s and all, I get very, very nervous about that. Needs to be looked into. Okay. What about normal things that we see? Simple posture. I can usually tell when somebody walks into a room and sits down, I can tell, man, you look old. In other words, the appearance. Old people, they look old sometimes. So what? Like I said, it's not a disease. So what if you look old? You should be proud of it, for God's sakes. You had a good life. Be proud of what you have. Make the most of what you have. And so, who cares if you hump over a little bit? They call that a kyphosis. Maybe a little bit of turn to one side or the other. Now, you've seen these people walking over and they're humped over a little bit. We tend to blame them. It's not necessarily their fault. They just happen to have their joints fixed in that position. And so they have to compensate. They'll breathe a little faster to try to get that more air in. So we can tell sometimes just from the appearance of the people what things are like. Let's work our way down. Start with the hair or the lack of it. What happens when you get older? Less pigment, get white. Less hair. And it's not just in the men. The women have thinning hair as well. It's amazing the number of people who go in to see these people who are the hair cosmetologists, you know, and yeah, we can put more hair on your head. What the heck? Why do you need more hair on your head? It's not like you're out looking for others to be with, accept you for what you are and what you look like. It's ridiculous. But hair, no question. Less hair, thinning hair, and sometimes that male pattern baldness. Also the nails. Your nails are now less shiny. They have little, what they call longitudinal striations in them. They don't grow as fast. Normal. That is normal. Nothing to be concerned about. What about your voice? The voice tends to be lower now. That's because of some aging in the vocal cords. They're stiffer. They don't have that elastic quality to them anymore, so your voice tends to be lower. Normal. Totally normal. When you get a hoarse voice, that's a different story. Time to call the doctor. They need to look down. You may have a little growth or something on that vocal cord, which is causing hoarseness. Okay, that's for the voice. What about the general balance? Balance requires, first of all, good vision. No problem with the inner ear where the balance center is. And it depends on the nerve endings in your legs and in your body. Those nerve endings are called autonomic nerves. They will tell you your exact position with respect to the rest of the body and to everything in your environment. They deteriorate as well. Our eyes deteriorate as well. Our ears deteriorate as well. We'll talk about those two senses in a minute. But the combination of those results in an imbalance in the body. Now, you may get your imbalance because you had a stroke and they're weak on one side. That I understand. But the natural progression, the diminution of the vision, the hearing, and the nerves in your body result in a lack of good balance. Also, you're not as flexible as you used to be because of some loss of elasticity, loss of muscle in the body. Not as flexible. Also some arthritis. A lot of people have arthritis. 60% of the people have osteoarthritis, or maybe even worse, rheumatoid arthritis. But that is a big issue. And so that's why exercise is so important in the elderly. The treatment is prevention. Pure and simple. Get good balance by getting your muscles and all back in shape again. You may never get that vision perfect. You may never get that inner ear perfect. You may never get those nerves back. But if you can control your muscles, at least you're giving your body a chance not to fall. So, okay, that's just my little spiel on exercise and its value. Let's talk about the mouth. What about the mouth? Well, our gums recede. And now that's not a good thing for your teeth. Dentists like it. Good business for them, because you're going to lose some of those teeth. And nowadays they're putting implants in. But remember, an implant in an elder person isn't the easiest thing in the world. The bone may be a little less strong, a little more brittle. You may not bleed as the same as when you had a younger tooth. And so, not an easy procedure to do in an elder person. So, gums receding, dry mouth. Be surprised how many people have a dry mouth. And all they really need to do is to constantly wet it. They need to have more hydration. It's very simple. Prevention. You don't need to call the doctor because you got a dry mouth. You need prevention, hydration. Now, another big item, your eyes. And I'm going to spend a little bit of time on the eyes, because the eyes themselves go through a lot of changes as we get older. First of all, you may have what they call dry eyes. Your tears begin to diminish. One of the two major causes of redness in your eye is allergy and dry eyes. Dry eyes, you can treat it with products that you buy right over the counter. There are products that have mineral oil in them. There are products that have methylcellulose in it. And you may even get a prescription for a thing called Restasis, which stimulates your own tears. It's cyclosporin, that's the trade name, but Restasis is the brand name. Unfortunately, it's expensive, as are a lot of drugs nowadays. So we try to get by with what you have, with the money you have. Just use the drops, and use the drops least expensive, either with the methylcellulose or the mineral oil in it. Opposite to that, what if you're tearing all the time? You say, gee, I'm producing a lot of tears now. No, you're not. What happens is that those tears go through a little duct. You know, right in the middle part of the eye and the medial part here, there's a little punctum, a little hole there. Drains the tears into the back of the throat. If you have infection in that eye, infection always heals with scar. You can scar up that little opening, and now tears can't go down. That you need to call the doctor about, because they can just take a little dilator, dilate that up, maybe even put a little tube in there. So now you can, once again, drain your tears. Just the opposite of the people who have dry eye, sometimes they'll put a plug into that little hole. So whatever few tears you have will stay in your eye. So that's when to call the doctor, when not. So that's just one thing, dry eyes. Number two, a lot of people's eyelids now begin to sag a little bit because we've lost the elasticity. They call that ptosis, P-T-O-S-I-S, ptosis. Sometimes, if it begins to invade the pupil a little bit, go over the pupil, your vision isn't as good, especially looking up, and so they have to take a little piece of that eyelid out and pull it back up again so that you begin to get better vision again. The only time you need to see somebody for it is when the vision starts to be affected by it. So that's eyelids. What else? Well, you may get some trouble with coming in to a dark room suddenly, or suddenly turning the light on. We used to accommodate pretty quickly to the change in the lighting, or lack of. Now it takes a little time sometimes. May even take 5-10 seconds. That may seem like an eternity at first, but we don't accommodate as fast. Is that normal? Yes, it is normal. They can't cure that. That's part of aging. What else goes on in the eye? There's a thing called presbycusis. They love to use, presbyopia. Presbycusis is with your ear. Presbyopia. Aging of the eye. What it means is that you're holding that newspaper way out here now so you can see it. That's what it means. That you can control. Just get reading glasses, $5. You get a good pair of reading glasses. Keep one in each room. No problem. That's called presbycusis. That's because the lens in your eye is aging too. It's stiffer. Doesn't accommodate as well. That's why we're having trouble reading. What else goes on? That same lens that's in the eye can start to get what they call opacifications, cataract. Very, very common in older people, cataracts. Simple procedure, big money maker for the ophthalmologists who do these things. They can rip off 20, 30 people in a morning. That's how many they can do. It's amazing. And they put a new lens, artificial lens in. And usually they put a lens in so people can have good distance vision. That means you still need to have reading glasses to read. You had that lens in for distance, and now you need to read. You take one of those $5 glasses, and you can read again. Nowadays, they even have a lens that will do that yourself. You don't need to have special reading glasses. But those lenses are about 10 times the cost of a regular lens that they put in. So you don't need to spend the money. Spend it for the $5 pair of glasses. So that's presbyopia. What else happens? Well, you also can have difficulty with colors. Usually the better colors after we age are yellow, orange, and red. In other words, colors like green and blue are a little more difficult as we age. Why? Because, again, aging of the material in your eye that calls the colors. That's normal, absolutely normal to have that. What are the abnormal things in the eyes besides the things I told you about? First of all, pressure in the eye, glaucoma. Open or closed angle glaucoma. The only way you can diagnose it, because it may not have any symptoms at the beginning, the only way you're going to diagnose it is by having the eye doctor test the pressure in your eye. You should do that at over 70, over 75 every year. You need to have an eye doctor check your eyes. Guaranteed there's going to be some change from year to year. Probably not for the better, but many of these things can be remedied. And incidentally, it's a good time for me to mention that over the Spirit of Shrewsbury weekend at the Senior Center, we're going to have the people from the New England School of Optometry come in and show you all of the little things that you can use when the doctor tells you, when your eye doctor tells you, I can't do anything more for you, your vision is lousy. Well, your vision may be lousy, but there still are little things that will help you so that you can be more functional. That's the presentation that they're going to make. So please come to the Senior Center that Saturday, the 28th of September, to learn about these things and to see them in action. Okay, that's getting away from the rest of my stuff. Age-related macular degeneration. Again, two types. Most people, fortunately, have the dry type. What is macular degeneration? First of all, the macula is the center of the eye where you do all your central vision. If you get the deposit of this fatty material, they call them drusen, the deposits that go into the retina and under the retina, they lift the retina up, you don't have vision in those areas. How do you test for that? You put up what they call a grid. It's just a series of lines that go up and down and cross. You look at those, and if they're all straight, you don't have macular degeneration. Macular degeneration is a loss of some vision. In other words, those particular lines, when they start to get wavy and all, that tells you you need to see the ophthalmologist. Not the optometrist, ophthalmologist, because they need to do a CAT scan of that eye and see what that retina looks like. So, age-related macular degeneration, one of the major causes of vision loss, major causes of losing your driver's license in the elderly. So keep that in mind. Make those appointments with the eye doctor annually. What else can happen? Well, I had a damn retinal tear, believe it or not. And I know why I had my retinal tear, because I was doing these crazy inversions with the exercises that I did. Showing off, that's what it was. But I had a retinal tear. Had to be repaired with a laser. Okay, I accepted that. But again, no symptoms except vision loss, sudden vision loss. Maybe part, maybe only in one section, or maybe full. Any vision loss, any flashes of light, multiple little floaters, you need to see the eye doctor. Those are the reasons to see the eye doctor. Okay. Talk about ears. What are the things that happen with the ears? high frequency hearing loss. They call that presbyopia. So at any rate, this does happen too. Do you need, like I got, hearing aids? You probably read in the paper not that long ago an expo of all the places that sell hearing aids. You know what they get for this hearing aid now? $6,500. Unbelievable. How could a little thing like this cost $6,500? You can buy a car for less than that. A used car, of course, but you can buy a car for that. They were raking it off. You don't need to have these fancy hearing aids. There are some inexpensive ones, and so what if somebody can see it? For God's sakes, your hearing will improve. That's the important thing. Who cares if they happen to protrude from the ears? For God's sakes, you gotta be reasonable about these things. Your earlobes tend to come down a little bit more, especially in the women who have had earrings all their life. They tend to come down. Your nose tends to shrink at the tip, so you get like a little hook in your nose. So what? That's you. Enjoy it, for God's sakes. Don't worry about it. You don't need plastic surgery on that sort of thing. That's normal, totally normal. As we age, we begin to lose a little bit of the sense of smell. When you're 65 and over, you've lost half of your taste buds in the tongue, too. You don't have the taste that you used to have. So what? You may not be a wine connoisseur anymore. Can't be a snob anymore. Yes, you sure can. You can still, BS your way through something. No big deal there. That was half the fun of it anyway, let's face it. But your taste buds deteriorate, especially sweet and salt. Sweet and salt. You begin to lose that. Half of them are gone by the time you're 65 to 70, unfortunately. What else? Let's migrate down a little bit. What about your thyroid gland? That produces less thyroid hormone now.
Excuse me, Doc, we're getting down to the end of the first half hour.
Boy, we really went through that, didn't we, huh?
Ladies and gentlemen, please stay tuned for the second part of this interesting subject that Dr. Claremont has brought up. We will be back as soon as possible. Thank you very much for watching.